Hello everyone, OT Lifehacker here with lab values once again. So, if you have seen the CBC, the complete blood count, perfect. If you haven't seen it yet, please make sure to check out that video. I will put it in the description box below. Today we are going to talk about electrolytes. So, we are going to start off with the potassium. Normal is between 3.5 to 5. Low potassium hypokalemia is caused by urinary loss, such as vomiting or diarrhea, malnutrition, restrictive diets, alcohol, Cushing syndrome, GI impairment, so gastrointestinal stuff, diuretics, trauma, chronic renal disease, and know that there can be others as well. If you look at a bunch of different resources, you'll find many other stuff, just as I did to create these resources. And I would like to add that just like for the other resources that I made, as you know, the CBC and then also the acute care lab values, those are all going to be available resources, this too, in the respective video. So make sure you check out those videos if you want to see those resources. And I will have this resource, the electrolytes that I made, in the description box below as well. Now make sure that you like and subscribe. These resources are all totally free, but it helps me a lot and helps others to find this video by liking and subscribing and definitely sharing. So please do share the wealth. And I also want to say thank you to everyone who has given me positive feedback about the videos, as well as letting me know how it's been helping them, my other resources. This is why I'm making the videos, because I'm so glad that it's been helping you guys out in your field works. And even for new therapists too, I've heard from quite a few of you saying that it's been super helpful in the stressful changes with everything. So I'm really, really glad. So getting back to low potassium, as we said, these are some of the causes. And then if potassium is less than 2.5, it is likely that you'll need to hold the activity. So in acute care, you'll need to always check the lab values, because there can be a lot of instability in the patient's vitals and labs health in general, right? So that can increase the risk of other complications. If you're doing therapy with them when they have very low or very high lab values, that can actually be a risk of contraindication. That can be a risk of more complications. So you have to be very, very careful. And that is why it's always important to check in with the team. Symptoms that you may experience if they have low or high, and of course, after discussing with the team, if it's okay to see them, make sure you check out for any extremity weakness, so in the arms, the legs, the feet, decreased reflexes, paresthesia, leg cramps, EKG changes, so if there's changes in the heart, cardiac arrest, hypotension, constipation. Hyperkalemia can be caused by alterations to the kidney function, renal failure, diabetic ketoacidosis, Addison's disease, blood transfusion, I just put that twice, sorry. Lead poison and insulin defect, trauma from a crush or burn, or chronic heparin therapy. Hyperkalemia above 5.5, you'll need to collaborate with the team, as most likely you'll need to hold. Symptoms can include muscle weakness, paresthesia, bradycardia, heart block, ventricular fibrillation, cardiac arrest. Now, it's important to pay attention to potassium needed for neuromuscular function. So if it is less than 3.2 or greater than 5.1, that may lead to muscle irritability or cardiac dysrhythmias. So at or less than 3 or at or greater than 6, no exercise should be done. And caution, monitor for the 3.1 to 3.4 range or 5.1 to 5.9 range, because remember, this is the normal here, 3.5 to 5. Vitals should be normal, resting, and the oxygen should be above 90%. And make sure that you terminate the session if they start feeling numbness in any part of their body, dizziness that doesn't go away after 60 seconds, within 60 seconds, blurred vision, nausea, increase in heart rate, and changes in the diastolic and systolic, because again, that could be a risk for the orthostatic hypotension as well, and shortness of breath. Now, creatine kinase, this is the enzyme that activates the reversible phosphorylation of creatine by means of adenosine triphosphate during muscle activity. So the normal for males is 52 to 336 and females is 38 to 176. So what you need to know is the importance of holding activity if the creatine kinase rises, and resume when the levels trend down into the normal. And always make sure that you're checking in with the team. Lactic acid. Now that is what's made by the muscle tissue and by red blood cells. Normally the level of lactic acid in the blood is low. So the level, lactic acid levels can rise when oxygen levels decrease. So the normal is 0.5 to 1. Above 1 creates lactic acid due to change in the pH balance, and it is recommended to hold activity when the level is greater than 4. And again, always check in with the team. So team collaboration is always, always important, because someone may have seen this person before you and they had similar values, and they can tell you like, oh, like they were okay during the session, what happened during the session, what to look out for. So always check in. Then glucose, normal fasting is 70 to 110. And if it's greater than 60 to, if greater than 60, 80 to 115. I have to check what I meant by this. I don't know what I meant by if greater than 60 here. So I'll check back on that. Increased because brain tumor, IV glucose, diabetes, just 8, postprandial state, Cushing's, pancreatitis. Decreased because of brain damage, pituitary deficiency, Addison's disease, insulinoma, excess insulin. Therapy implications include no exercise if the glucose is less than 60 or greater than 300. Signs of hyperglycemia are extreme thirst, frequent urination, dry skin, hunger, blurred vision, drowsiness, nausea. Sign of hypoglycemia can be hunger, nervousness, shaking, perspiration, sleepiness, confused, dizziness, lightheadedness, difficulty talking, feeling anxious or weak. For calcium, this is what is needed for bone formation and cell division and growth, as well as other things. Normal is at 8.6 to 10.3, and hypocalcemia, which is below the normal, you'll need to monitor activity, as this may have cognitive impairments. So some causes of hypocalcemia can be alcohol abuse, poor dietary intake, limited absorption of the GI tract, the gastrointestinal, pancreatitis, and laxative use. Symptoms can be anxiety, confusion, fatigue, impaired cognition, numbness, tingling, EKG changes, seizure, agitation, and muscle cramps. So these are things to look out for if you are seeing a patient with their vitals lab value low. And of course that it was okay for you to see them. Hypercalcemia, which is above the normal, you'll want to, again, monitor the activity as there may be signs and symptoms. Some causes that you should know about can be bone destruction, fractures, immobilization, excessive calcium, excessive vitamin D, cancer, renal failure. Now, we go over the causes because in the chart review that you do in acute care, you may see that this person, say for example, they're in because they have a fracture. Well, you gotta check. Is there anything changed in their calcium? How is that? And if there are changes, look at the symptoms, and it's okay to see them, check the symptoms. Symptoms include coma, lethargy, nausea, vomiting, muscle weakness, constipation. Sodium. Sodium normal is 134 to 142. And what sodium does is it determines the amount of water needed in the cells and around the cells and assists with maintaining the normal blood pressure. Low hyponatremia is less than 130. So causes can be diuretic, GI impairment, burns, wounds, hypotonic IV use, cirrhosis. Symptoms can be headache, lethargy, decreased reflex, nausea, vomiting, diarrhea, seizure, coma, orthostatic hypotension, pitting edema, and impaired cognition. High sodium is called hypernatremia, and that is above 145. Some causes can be increased sodium intake, severe vomiting, congestive heart failure, renal insufficiency, Cushing syndrome, and diabetes. Symptoms can be irritability, agitation, seizure, coma, hypotension, tachycardia, decreased urinary output, and important, the impaired cognition, seizure precaution, because if you see they have low sodium or high sodium, and you're seeing the patient and you do your the ONA, the orientation and alertness, and you find that there's been changes in their your results and scoring for that, well, it could be due to this lab value, the sodium. So again, it is so important to make sure you know the symptoms and what to look out for, because that's one of the important things to look for in the chart review for safe care. Chloride. Normal is 98 to 108. Low is hypochloremia, and causes can be low salt diet, diuresis, water intoxication, excessive vomiting, or diarrhea. And symptoms can be agitation, irritability, hypertonicity, increased reflexes, cramping, and twitching. So I have seen that in patients before where they have had cramps and twitches and hypertonicity. So again, you have to be very careful, check the lab values, and know what to be prepared for. High hyperchloremia. Causes can be high salt, low water, hypertonic IV, metabolic acidosis, renal failure. Symptoms: edema, tachypnea, which is rapid breathing, tachycardia, weakness, hypertension, decreased consciousness. Phosphate. Normal is 2.3 to 4.1. Low. The causes can be alcohol abuse, poor diet, limited GI absorption, laxative use, pancreatitis. Symptoms can be anxiety, confusion, agitation, seizure, EKG changes, so again, check the heart rate, fatigue, numbness, tingling, increased reflexes, muscle cramps, impaired cognition. High can be caused by bone destruction, immobilization, fractures, excessive vitamin D, cancer, renal failure. Symptoms: ventricular dysrhythmia, heart block, acetol, coma, lethargy, muscle weakness, decreased reflexes, constipation, nausea, and vomiting. Magnesium, the normal is 1.2 to 1.9. Low, caused by alcohol abuse, eating disorders, diuresis, diabetic ketoacidosis, medications. Symptoms can be increased reflexes, tremors, spasticity, seizures, nystagmus, EKG changes, emotional lability. So make sure you're checking for their emotional states and any changes, especially rapid, dramatic changes. High for magnesium can be caused by increased antacids, renal failure, leukemia, dehydration. Symptoms to look out for are diaphoresis, which is sweating, especially profuse sweating, nausea, vomiting, drowsiness, lethargy, weakness, decreased reflexes, hypotension, and heart block. So that is the electrolyte lab values. And of course, if there's others that you find and you're in acute care, you find to be important, please do let us know in the comments below. But these are the ones that I found very important, that I was informed to always be checking, as well with my husband being a doctor. What he says is very important to look out for. So if you want this resource, make sure to find it in the description box. And please, if you do use it, please do like, share, subscribe. That will help me out a lot, and that will help others to find this video so that it can help them in their acute care. And again, if you want the other videos for the CBC count, the complete blood count lab values, as that is highly important. That's what we always need to check in acute care. And if you want the safety checklist, then also find that in my video, in my description box. You'll find the video links for them. And please make sure to, if you have questions, find me on Instagram at ot_lifehacker. And again, please do like, subscribe, and share. That helps so much. All right, thank you guys very much, and I will see you all next time. Bye bye.